Now, do you suffer from seasonal allergies? Many people do, and the symptoms can be miserable. Itchy, watery eyes, sneezing, that tickle in your throat. But there's relief in the form of over-the-counter medications, and they can make a huge difference. But you need to talk to your pharmacist before you get into the right medication. So Angela MacNeil is a pharmacist and the owner of 3 Shoppers Drug Mart locations in Halifax and Bedford. She joins us this morning to chat about spring allergies. Good morning, Angela.
Good morning.
So let's chat about spring allergies. When are the worst times of the year for allergies?
So typically they start in spring, so we're looking, March, April, and it can continue into summer and into the fall. Those are when the pollens are the worst for most people.
And we were chatting casually before this interview, and I was saying my allergies don't seem as bad this year. You were saying yours are not as bad either.
And it differs from people to people. Mine don't seem too bad. I suffer more for fall allergies myself. So the spring, and we're starting to ramp up into the summer allergies now. So it may be worse now for some people, and then in the fall for them, it kind of tapers off.
For sure. And weather can play a role. You were saying that like dry, windy, much like today's forecast would be bad allergy weather, but we've had a very cool, wet spring. So that may be the reason why some of us aren't as suffering as much.
Exactly. And we kind of always recommend check the pollen forecast. And if it's going to be high, there are things you can do to kind of mitigate bringing those pollens into the house, showering when you get in the house, things like that. Exercising indoors on those days when it's dry and windy and the pollens are going to be higher, making your allergies worse.
All right. So we're showing images right now of people suffering from allergies. When you are experiencing an allergy attack, it is not pleasant. What can you actually do about that?
There's lots of medications. Sometimes it can be overwhelming. There's over-the-counter medications, there's prescription medications, and these are all things we recommend. Come on into Shoppers Drug Mart to speak to your pharmacist. We can make recommendations on some products. We can prescribe medications for you if we think that that's necessary. It's really important, too, if you know you have allergies in certain seasons, to actually try to get ahead of it. So come on in. We can make some recommendations for products and kind of work through what your symptoms are. And anywhere from medications like pills to nasal sprays, inhalers, eye drops, there's so many options. And like I said, it can be overwhelming, but that's what we're here for. So come into Shoppers, talk to us, and we can definitely help you pick something out.
Okay, so I know that you were saying it's important to speak to a pharmacist because certain allergy medications can actually have negative effects when mixed with other medications.
Exactly, yeah. Especially high blood pressure, heart medications. There's a lot of over-the-counter products that come with additional products that can affect your heart conditions, can affect your interactions with certain medications that you take. So always check with your pharmacist before you take anything off the shelf.
All right, what's the difference between an over-the-counter or shelf-type allergy medication and one that you'd be prescribed?
Just a bit stronger. Lots of great products over the counter, and we'll kind of start there. And then if you find you're not getting relief like that, we can a lot of times prescribe for you, and they're just kind of the next step up. So a little bit stronger, kind of dial into more of your symptoms and see if we can kind of help get you some symptom resolution.
And then there are different, when you go to even the shelf, there are many different allergy medications. If you look at the actual, there's a brand name, but then you look at the actual medicinal, there are different products. So what do the different allergy medications do?
Yeah, so we've got your antihistamine, so everything's going to help with that runny nose, those watery eyes. Some people, they complain more about the itchy, watery eyes. So you can get eye drops specifically to help with that if the symptoms are worse. If it's more of congestion, post-nasal drip, there's specific steroids that you can take, nasal steroids, to help with that congestion, that post-nasal drip. So there's so many options. And like I said, come on into Shoppers, speak to the pharmacist. We're very good at dialing in and finding out which one's going to work best for you.
And you got your Benadryl and you got your Claritin, like they're all
your
different.
reactants, yeah, absolutely, yeah.
And then the medications underneath that are all a little bit different. What about different ages and stages of life, like children versus adults versus seniors?
Yeah, so, and we've got, the dosage is going to matter at that point, right? So, less dosage for pediatrician population, and sometimes the dosage is less for senior population. As you get older, your needs change. So it's, again, just good to check because we want to make sure that we're not interfering with any other medical conditions or medications that you're taking, and we want to make sure that you're not taking too much of a medication.
For sure. My last question for you is, if you don't have a primary care physician, can a pharmacist prescribe allergy medication for those who need it?
Yes, absolutely, yeah. We've got this wonderful expanded scope of practice now that pharmacists are really starting to embrace, and we're able to prescribe for those medications. So if you get into a situation where you've tried the over-the-counter products and they're just not helping and you don't have a primary care provider, absolutely speak to your pharmacist, because there's definitely instances where we can prescribe.
All right, well, thank you so much for coming in this morning.
Thank you for having me.
All right, that is a chat about spring allergies.